Hi there, my name's Carolyn Orr and I'm a medical doctor. I'm here today calling on healthcare workers in Western Australia to step up to the challenge of climate change. At 1.1 degrees Celsius global heating last year in the eastern states, we saw a mega bushfire never before seen in Australia. This caused the deaths of 34 people and then 445 people died after this through the effects of toxic smoke inhalation. 6,000 Australian families became homeless and roughly 3 million animals were killed as well in that mega bushfire. Here in Western Australia, recently we had the Perth Hills fire that made 86 of our local families homeless. Now we're told by environmental scientists that this mega bushfire would have been impossible without the warming and drying effects of global heating on our planet. We know that as that trend continues, we're going to see more and more of this, and we know also that we're currently on direct trend to be 4 degrees Celsius above safe baseline by the end of this century. Now, the recently published Western Australian Climate Health Inquiry, authored by Western Australian doctors, makes it absolutely clear that this decade is critical in addressing climate change. Because of the cumulative nature of carbon dioxide emissions, if we don't address this now, we're locking in global heating for decades to come. What are the human effects of this going to be? We're going to see more deaths through fire. We're going to see more deaths through smoke inhalation. We'll see deaths through heat stroke. We'll see tropical diseases appearing in parts of the world where they've never been before. We're going to see parts of the world, and particularly Australia, becoming uninhabitable because of both global warming and also sea level rise. And we're going to see mass human migration on a scale we've never seen before. Most worryingly, we're going to see agricultural failure and face the prospect of mass starvation as this trend continues. Our children are going to inherit a world that's completely unlike the one we have now. Now, despite this, at both state and federal level, our politicians are not responding to the threat of climate change. Only a couple of months ago, the State Parliament of Western Australia green-lighted the Burrup Hub gas development. This is a mega fossil fuel project that by itself will give us the equivalent of 11 times the whole of Australia's carbon emissions over its lifetime. This is insanity on a gargantuan scale. We can and must stop this happening. Every day, every week, every month, every year that we allow our politicians to delay action, we're making the problem harder and harder to solve. This government is not going to commit to any meaningful action until we absolutely force them to do so. We need to make it absolutely clear that the public isn't going to stand for any more delay, and we can't be fooled by fake targets like net zero by 2050. Net zero by 2050, which the government is currently debating committing to, actually takes us to 3 degrees global warming by the end of this century. It's a nonsense target. We can't allow them to fool us like this. So I call on all the doctors of Western Australia. I call on the nurses. I call on everyone that works in allied health. I call on the administrators that support us. Anyone and everyone that works to any degree in the healthcare system, please step forward, step up with us and join us in the fight against inaction on climate change. Now today I'm here in Stirling Gardens, and on the 22nd of March, which is a Monday, at 10 o'clock in the morning, Extinction Rebellion, the peaceful civil resistance group, is leading a rally to demonstrate how much we care about our states and our country's inaction on climate change. Please, please come down and join us. Step forward, step up, and join the fight for a safe planet for both ourselves and our children.